Hi, welcome to today's Medicare and More program. My name is Ed Roth. I'm the Central Region Director for the SHINE program.
And hi, my name is Kerry Faria. I'm the Assistant Director of the Central Massachusetts SHINE program. Welcome back.
Thanks, Kerry. And today we want to spend a little time talking to you about updates to Medicare. There's quite a few changes for the plan year 2016. We had a meeting with a lot of the plans yesterday and got some information that will be interesting, I think, to folks. So we want to talk about that a little bit. The first thing I want to talk about, though, is a little information for state employees and state retirees. If you're a state retiree and you're in a GIC, the GIC indemnity plan, your drug program is going to be changing. In November, they're going to be sending you a membership card for SilverScript. SilverScript is a Medicare Part D plan. And you're going to be getting some information from SilverScript regarding the plan coverage and material concerning the plan coverage. GIC has informed you, you've gotten letters from GIC about this, and we want to make sure that first thing you do, follow the instructions with SilverScript, okay? But be sure not to opt out. We want you to be sure to stay with the SilverScript program. Between SilverScript and GIC, the same coverage you have now will be maintained. You don't have to worry about something not being covered, something not being on the formulary, or anything like that. So the same coverage will be maintained when you're in the SilverScript program. Just want to be sure not to opt out. And if you have any questions at all, you need to call GIC, and they'll be able to answer your questions. They'll have some special phone lines hooked up and the like to get to you as soon as possible and answer your questions. But they're the folks you want to talk to. If you do change and somebody tells you, hey, join a Medicare Part D plan other than SilverScript, you could lose your GIC coverage. So you have to be very careful about this. So that's something I wanted to open today's session with, just to let folks that have state retirees that have the GIC plan, the indemnity plan, not the Medicare Advantage plans they have, but the indemnity plan, that this is coming. You'll be getting mail on it probably in early November or late October, and we just want to be sure you know about it. Just stick with GIC and SilverScript, and you'll be fine. Otherwise, there may be an issue. Kerry?
Ed, a question for you about the SilverScript plan that people are going to be going with GIC. When people have a Medicare prescription drug plan, they usually have the donut hole or the gap. Is that going to be true when they get on the SilverScript plan combined with GIC? Absolutely
not. There will be no exposure to any donut hole. The plan will run the same way that your GIC plan runs now. So there's no exposure to anything like that. They may talk about the donut hole and the information you receive from SilverScript. Ignore it. There's no exposure to the donut hole with this plan. So you know, it's a little strange. It's new for folks, but we just want to be sure that you stick with GIC and SilverScript. Things will work well for you. As a matter of fact, I'm told, and the information that I received in the mail, and most of the GIC beneficiaries received in the mail, indicated that the network pharmacies are broader, and there's more network pharmacies with SilverScript than you may have had with the regular CVS Caremark program we had up until now. So that's a benefit you'll get. So just stick with the SilverScript and the GIC, and you should be fine. We also got information yesterday about the various plans and how they're going to change in 2016. Kerry, you want to talk a little bit about Blue Cross?
And one of the things I would like to mention before we get started a whole lot in talking about the plans is that the open enrollment in which you make a decision, it will be October 15th through December 7th of every single year. So that's the window of time of which you would do your homework on the plans, or you can give us a call about the plans, what your options are, and discuss that. Then you would want to make a decision and then actually make your commitment within that window of time, and then the new plan would start January 1st. So again, that time frame of which you have to make a change, or they have the option of researching the plans and making a change, is October 15 through December 7th of every single year. So we want to make sure that you make that changes and research the plans within that window. So to start out with, I'm going to talk a little bit about Blue Cross Blue Shield. There are some plan changes coming for 2016. One of the plan changes they have available is they've added a new product. They've added what's called an HMO POS. And what that is yes, it's an HMO that has an in-network component, but the POS stands for point of service, and that means you can go out of the network. So with that, though, again, you can go out of network, and it is point of service. So that means at any point in time, though, you can go to the doctor's office, they can say they're going to take the insurance out of network, and then if you want to go back for a second time, the doctor can say, I don't really want to take that insurance. So there is some risk to that, using it out of the network. So just be aware of that. But again, if you want to get more details on that, you can call our office. We'd be happy to talk to you about that. Their changes for 2016 with Blue Cross Blue Shield is pretty much across the board, except for one of their plans, there's been a premium increase. So, but most of the plans do that every single year. There's one plan in particular that didn't change their premiums, but we'll talk about that a little later. But with Blue Cross, again, kind of premium increases across the board, with the exception of their Saver RX plan. That has no premium increase. That's going to stay the same. It has a 0 premium. So that's really nice. The other thing to be aware of is sometimes with some of the hospital copays, with the Blue Cross Blue Shield plans, they have increased their copay amounts as well. So that's a little change for 2016. And also the cost for the high-tech imaging has also increased. So high-tech imaging is things like MRIs, that would be a CAT scan, that would be a PET scan, scans like that, all in high-tech imaging. So those prices have increased a little bit. And also something for 2016 is that Blue Cross Blue Shield has made an arrangement that now you can get dental coverage. They've partnered with a different company to do that. So dental coverage can be purchased by somebody that's over 65.
Okay, Kerry, thank you very much. And just to reiterate, on Blue Cross, we got a call in the office the other day. Folks received their Medicare and You booklet, and in that booklet, the plans are listed and their premiums. Got a call the other day from a woman who has an HML Blue Plus RX plan. Now that premium of that plan, the lady informed me, was $193 in 2015. Well, the plan has gone up this year for 2016 to $235.50. Now that's a significant increase, and the lady was concerned about it. So we talked to the woman, and we're able to talk to her about an alternative that she may be able to use. You know what I mean? Alternative. So we sent her out one of our drug search tools, and she'll send it back to us, and we'll do a drug search for her, and she may be able to pick up one of the Blue Cross Medigap plans or supplement plans that will provide her with even better service than the HMO would have, and it'd be a lot cheaper for her. So again, if you're in a situation where you see a plan increase like that, a significant increase of more than $40 a month, that's a lot of money for some folks. So if you want to give us a call, we can talk to you, see what your situation may be, and we may be able to recommend another plan for you. That's with all of these plans. All of these plans, they change, and some of the increases are out there. So we want to be sure that you have a plan that fits your needs, economically as well as health-wise, because the dollar is important today, and we want to make sure you're spending your health care dollar as wisely as you can, and that's what we do for folks. Again, we certainly don't recommend, or we don't endorse any plans, or we're not selling anything. We're basically looking out for the folks to make sure, for the people at home, to make sure they're getting the biggest bang for their health care dollar. That's important to us. That's very important to us. Kerry, we also had the folks from Fallon come out.
We did have the folks from Fallon come out, and also, again, some of their plan information for 2016 is a little different from this year. So again, there's some changes. They do have a 0 premium HMO, and that will stay the same. So there's no changes to that plan pretty much, I mean, as far as the premium goes, no change with the premium. There might be some slight changes with the co-pays, because again, from year to year, that happens. There are premium increases across the board with their other plans, however. So again, if you want to talk about the details of that, you can certainly give us a call. We can help you figure those details out. They have expanded who their preferred pharmacies are. Now the preferred pharmacies are CVS, Target, Walmart, Big Y, Shaw's, Stop and Shop, and Star Markets. So that's a change. They've expanded their preferred pharmacies, so that's a good thing. So that's what's going on with Fallon. Also, if you have to stay in the hospital or a skilled nursing facility, those costs are staying the same with Fallon. There's no real changes with that. So again, that's good news. Fallon also has an HMO POS, and that has, again, that in-network component, and you can go out of the network if you want to with that. Just to be aware, if you have that POS and you go out of the network, some services are just not covered, and they've made that clear with the material they've given us from year to year. So again, just a little caution with the POS. The doctor doesn't always have to take it out of network, and again, services may not be covered. Another thing to be aware of is if a person is taking cancer medications. With the Fallon plans, there's a co-insurance on that that's about 20%. And that can be really expensive for somebody that's getting any sort of cancer treatments that are under Part B medications. And Part B medications, again, are administered in a hospital or at a doctor's office. So again, don't expect everybody to memorize this stuff. Just be aware of it. Questions on that, we'd love to talk to you. Please give us a call. And so the next plan up would be Harvard Pilgrim.
Right, and Harvard Pilgrim, got material from Harvard Pilgrim. Interesting plan. I think their first, last year was their first year with their stride plans. They have 2 stride plans, and they're both pretty good. The pricing in those plans went up a couple of dollars each. Not bad, but what we're happy about is that they've kind of expanded their network a little bit. They've got some doctors at UMass Memorial. They've got that organization as a provider now. So folks up in the Shrewsbury and Greater Worcester area, that might be a good alternative for some folks. It's a good plan. It has some great benefits. As far as those, as Kerry just mentioned, excuse me, the Part B medications and the chemo medications have a 0 copay with the Harvard Pilgrim plan. So that's a positive thing. Also, we saw last year that with Fallon, there's a maximum out-of-pocket for most of these health plans. And Fallon last year increased that maximum out-of-pocket to $6,700. So you had to pay that much before. The plan was free. You had no more co-pays. Wonderful. But you had to pay $6,700 out of your pocket in most of their plans. This year, the business is the business, and we saw Blue Cross increase that maximum out-of-pocket in some of their plans as well. So it's something you want to be aware of. You're going to be paying a little bit more dough if you're a heavy user in some of these plans before you get into the area where your plan doesn't cost you any more money. There's no more deductibles or co-pays. With that Harvard Pilgrim plan, that remains at $3,400. So again, it's a good option for folks. If folks want to take a shot at that Harvard Pilgrim, you might want to see if your doctor's in the network, and we can help you We can help you with enrolling in that if you want us to, or you can give the plan a call directly. Kerry, any other highlights for Harvard Pilgrim?
Yes, a couple of other things with the Harvard Pilgrim plan. They're partnering this year with a dental program that you can buy into that looks a little interesting. And not only can you as an individual buy into that dental program, but you can add family members to that dental program, including grandchildren. So that's a new and interesting benefit that they're offering. And according to the prices, it doesn't look that bad. So that looks like that could be of some interest out there as well. And it's not dental insurance. It looks like, based on the rates that we've looked at, that you basically get about a 2/3 discount on those any sort of dental work, and it looks pretty expansive. So again, you've got to have the Harvard Pilgrim first you've got to be a member of that, because then they've partnered with this particular program for the dental. So that's an option. The other thing I would want to mention is they also have an over-the-counter medications or over-the-counter supplies benefit as well. So they give you a credit up to $150 on over-the-counter supplies. So, and that's $150 annually, and you can get that filled, you know, or reimbursed as you wish to. And that's also something that's a little different. And the other thing I wanted to mention that we talked about yesterday when the plans were talking with us is that Harvard Pilgrim has an expanded formulary. So their formulary is a little broader than the other plans, and they are covering some medications that the majority of other of the Medicare Advantage plans are not covering. I think there's one other plan that's probably covering the same sort of meds, but again, there's some expanded benefits with Harvard Pilgrim in that regard too. So a little interesting this year. They've really come to the front with their product. So that is also kind of, it's going to be a good option this year, I think.
Thank you, Kerry. One thing I want to mention too, on the dental coverage, we talked about the Blue Cross dental plan, and I just want to clarify. What that is, what Blue Cross has, they have a separate dental plan, okay, for people over 65. And anybody that wants to purchase that plan, no matter what plan they have, can purchase this Blue Cross product, okay? It's not necessarily associated with the HMO, okay, with the HMO or Medicare Advantage plans. It's a separate dental coverage policy that you can purchase if you have any HMO plan or any plan that does not cover dental. So again, a good product. It's something you can call Blue Cross about, and they'd be very, very happy to send you some information. Now, we also had the Tufts health plan in yesterday, and Tufts is interesting folks. They come in, they give us a nice presentation, but they're not increasing their premiums for any of their plans. So we're happy about that. So if you have if you have a Tufts plan, your premium you will not see an increase in your premium this year. What you're going to see, you'll see some small increases in co-pays. I think the main one I saw was a skilled nursing area and the hospital area. If you're going to the hospital, there's going to be some increases in the co-pays for that. Also, if you're going to a skilled nursing home, and this isn't just Tufts, I think all of the plans have identified this is an area where they're losing money, they can capture some more money, and they're going to increase their charges. They did have a charge before from days 1 through 20. Now they're going to try to capture a little bit of money for days 21 through 45 or 50, and after that, there'll be no copay after the 50 days. But this is another area where the health plans are, again, trying to capture a little bit more money and kind of balance their books a little bit more. So again, that's you're going to see that in most of the plans. Tufts is also the preferred provider down at Reliant now, and they've also got a little bit of better coverage in Worcester County as well. But you know, they're a good alternative. If you have it, it's a nice alternative for you. Kerry, we also had the folks from United Health come out. Anything else about Tufts you'd like to talk about?
One little thing about Tufts, in that if you, again, are taking any sort of medications for cancer, they have no copays. There's no charge for cancer medications, which is the same as last year. So we're glad to see that too, because that can be very expensive for folks. So no charges for cancer medications if you're getting them through a Part B benefit. So that's no change. United Health, looking pretty much the same. Like a lot of some of the other plans, they're going to have a premium increase on their plans. Not a lot. It's about $10 across the board on their plans. The other thing is that, again, on Medicare Part B drugs, which I was just mentioning, those are cancer medications or any drugs you get administered through a doctor's office or a hospital, their charge is going to be 20 to 30%. And that is a significant cost for somebody that's going through cancer. So, again, just to put that out there, but it looks like it's pretty much the same product as last year. No big changes on that. So that pretty much wraps it up for the Medicare Advantage plans. And I do want to mention, Toad, that what we are talking about are Medicare Advantage plans. This has nothing to do with supplements. The supplements, we haven't gotten a whole lot of information on any premium changes on the supplements. And not only that, they don't change from year to year. So if you have what's called a Medigap, or a Medex or a Bronze or a Supplement 1 plan, no changes to those. There might be some premium changes, but the coverage doesn't change. So
That's a good point, Kerry. And again, these supplement plans, these Medicare health plans are listed in your Medicare and You guide, and I think they start on page 156. It says Medicare health plans in Massachusetts. So most beneficiaries got this guide. All of these plans are listed in there. They have very limited detail, though. They give Medicare very limited information. We'll have some more information on the plans a little later this month, but it's very limited information. And if you want to call us, get more information, you can if you're interested in the plan. But again, they are listed in page 156, I think it is, in a Medicare and You book, and it starts with the Blue Cross plan and goes to a number of plans, and it'll list on there the counties they're available in, et cetera, because all of this stuff in the Medicare health plan field comes by counties. There might be a plan in Worcester that's not in Suffolk, the county. There might be a plan in Worcester that's not in Norfolk, and generally like that. And also the premiums are all based on counties. So it's a little bit complicated, but it's something we're willing and able to help you with, okay? And also, as Kerry mentioned, the Medicare supplement plans, we don't have a lot of polished detail on that yet. As far as the premium goes, the plans haven't changed. There could be some increases in premiums based on some stuff that happens with Medicare A and B premiums. But we haven't really got a lot of detail, but we are expecting some rate increases in the supplement plans. Again, we'll have that detail probably for the next program, and we might even have a slide we can put on in this program that will detail some of the costs of some of those plans. Also, very important. Kerry and I and some of our counselors will be going around to various senior centers throughout Worcester County. I think we've got about 25 dates for Medicare update meetings in senior centers. We'll put that schedule up in this program. You'll see it on your screen in a few minutes, and we'll run it a couple of times during the program. And hopefully you can make one of these meetings if you have any questions. We'll be happy to answer any questions you have. Kerry, a little bit about Part D, if we can.
Sure. First, my caution is, if you're looking at the Medicare and You handbook for 2016, please do not pick a drug plan from the list that's shown in the book, okay? Because that's just a list that shows premiums and tiers, but it doesn't show the sensitivity of the plans based on medications. And those plans are very sensitive to the drugs you take, and picking a plan from a list is a very poor way to make a decision on that. So again, if you're confused about that and you want to know the details on how to pick a drug plan, give us a call. That's what we do. We also have some partners in the field that can also help out with that. And if we think that you've got some sticky meds and it'd be better off for you to speak to somebody else, we'll tell you who the experts are as well. So just caution number one on that. There are some changes on what the drug plans are going to cost a little bit for 2016. So for example, if you're in a plan that has a deductible, there's going to be an increase in the deductible of about $40. So for 2016, the deductible is increasing to $360. And there's some other changes to the cost shifting within how the drug plans run. And again, if you want those details, you can certainly give us a call, and we'd be happy to go over that with you. But again, everything's increasing a little bit. And in some aspects, those thresholds and increases are a good thing, and in some aspects, not such a good thing. So, but again, if you want the details on that, I would certainly give us a call. But again, please, bottom line is, if you're looking at the Medicare and You handbook, yes, all the Medicare prescription drug plans are listed in here, but please don't make a decision based on a list. It's, you could run into some serious troubles with that. So if you're taking any drugs, give us a call, give one of our partners a call. We'd be happy to help you out with that. So, go ahead, Ed.
Yeah, and I was just trying to look it up. There's one drug plan, I think it's a Transamerica plan.
You're correct, yes.
That is reflecting a significant increase.
Yes.
It's going up 242% in their
Yeah.
premium. That's ridiculous. That's ridiculous. So we're encouraging folks, if you have a Transamerica drug plan, please give us a call, and we'll send you out one of our plan searches, and you can fill it out, include your medications, and we'll do a search of the Medicare website for you and see if we come up with a plan that covers your medications, and that will be a lot cheaper for you, because that's an awful, it's an increase. I don't know why they did it, but that's what they did. So we want to get as many people into a more reasonable plan as we can. So again, if you have that Transamerica plan, they say there's not a whole heck of a lot of folks in Worcester County that have it, but if you do have it and you're watching this program, make sure you call us. This is people I want to make sure call us so we can send you a drug plan and send you one of our drug sheets and save you a few dollars. It's important that you save a few dollars. Again, that's what we're all about. We want to make sure that you get the biggest bang for your buck in a healthcare dollar, because it's competitive, and you know, and a lot of folks don't understand it. And again, as people are watching this program, or your caregivers, or your family is watching this program, it's important that we're able to get this information out to help you. That's what we're here for. And you'll see our numbers show on the screen a number of times as this program is being broadcast. Feel free to call us. And I just want to emphasize that. We have partners that can help you. And we're looking forward to working with you during this open enrollment. Kerry, anything else?
Real quickly, if you're involved in a Fallon Total Care plan, Fallon Total Care terminated earlier, last day of September, you might run into some problems as of November with some drugs. We really strongly recommend you give us a call. So as a last plug, I'd say that. And thank you for tuning in. We're glad to be here, and we're ready for open enrollment.